The wonder of nature, born and free. But not always as this. Premature birth is common, but a huge risk. 1 in 10 of all 120 million annually born children are born premature. For the youngest ones, 50% of them are in the risk of severe brain damage.
Impermeable or variable blood flow is a huge challenge and a risk for every premature newborn, and a common outcome of this is irreversible brain damage or even death.
I'm Tormod, the CEO in Cimon Medical, and we are trying to improve this. We are working to prevent brain damage in premature and critically ill infants. We are developing NeoDoppler, aiming to monitor brain blood flow in these vulnerable patients. We are making Doppler ultrasound technology easily available and accessible for the users.
I am Sirian. In the treatment of our vulnerable patients, I'm dependent on that NeoDoppler works as intended in the point of care. Healthcare professionals should be able to read out critical information at a glance and react accordingly.
Hi, I'm Magne, the software architect in Cimon Medical. This technology has such a broad information supply and so many use cases. But displaying the really needed contents along with great usability, that's what makes an interface efficient.
Of course, effectiveness is a really important point for a project like this. It's mandatory that the users can identify, see and evaluate risks, alerts, or other information at a first glance of this device. Hi, I'm Sascha, and for this project we went with our 3D UX approach, meaning we started off with the very first iteration of wireframes to depict the first design. Well, after the first wireframes design, we started to evaluate the concepts that we created. And for this we talked to pediatric nurses, we talked to doctors, invited them into our laboratory, and we asked them to do certain tasks on the user interface. With the data that we received from the interviews, from the first tests, our research team was able to give us, as the design team, insights into what the user actually needs, what their pains are, and from that on also create first suggestions on how to improve this interface. This advice for us in the design team was a very important input to enhance the design even further. This also gave us the chance to go again into the conversation with the user, into a second user testing with the second iteration of the screens. The results were great. I'm proud to be part of such a groundbreaking project.
You know, as a mother of 3 children, one of them born prematurely, I'm very happy that there will be a device that reduces those risks. Especially one that is looking so great and is really easy and convenient to use.
It's crucial to have an interface to support our decision to the best of the outcomes for our children.
It does what it should do. That's what's needed. And this is great.
I love our new GUI design. It's not only looking good, we know that this is what our users are asking for.